very simple example. Whatever diseases we are found in the today's era, either we talk about the diabetes, or either we talk about the hypertension, or the increased number of cases of cancers. So each and every disease is not because of the only one pathological condition inside the body. मल्टीपल कॉजिटिंग फैक्टर्स आर रिस्पॉन्सिबल. अगर हम कोई भी एक डिजीज की बात करते हैं तो बहुत सारे पॉजिटिव फैक्टर्स हैं जिसकी वजह से वो डिजीज जो है हमारे बॉडी के अंदर डेवलप होता है. Here we are not only talking about the physical condition, but also the psychological diseases or the psychiatric cases. Either physical plane पे कोई भी आपको disease है या फिर mental plane पे कोई भी disturbances है, so उसके लिए कोई एक pathological condition is not required, but multiple causating factors. As for example, if your diet is not proper, if your sleeping pattern is not proper, if your lifestyle is not proper, if you are not balancing the stress in the way it should be managed, these all causative factors are responsible for the developing of one disease in your body, either in your mind. And that's why we consider it as a lifestyle disorder, right? Whatever diseases are happening around us, it included in the group of the lifestyle disorder. And that's why here with the medicine, the diet plays an important role for the permanent healing. अभी हम जो भी बात करेंगे वो शायद उसके लिए ट्रीटमेंट वर्ड वी आर नॉट यूजिंग, बट द हाउ द डाइट हेल्प टू क्योर एंड टू गिव दैट परमानेंट हीलिंग to your body as well as to your mind. So clinical nutrition is not the regular diet, but it is a modification of the diet, right? What we are consuming on the daily basis, we are not talking about that. We are talking about the modification of the diet which can prevent the further complication or which can heal the prevailing diseases inside the body. So we need to modify the diet either on the basis of the quantity of the diet or the quality of the diet or the frequency of taking the diet. So this modification is required under the guidance of the clinical nutritionist or either any food expert you can go for.
तो ग्रेट डॉक्टर वाशिनी, हम लोग डायरेक्टली टॉपिक पे आते हैं. हमारे दर्शकों के लिए आज आपके पास क्या है जो अपने लाइफस्टाइल में, अपने न्यूट्रिशन में क्या चेंजेस लेके आ सकते हैं, या किस तरह से इस टॉपिक के बारे में और डीप में जान सकते हैं?
ओके, सो ये हमारा फर्स्ट वेबिनार है ऑन द क्लिनिकल न्यूट्रिशन. तो हम बहुत ही बेसिक बातें जो है वो करेंगे और हमारा पर्पस ये रहेगा कि एज मच एज वी कैन स्प्रेड द अवेयरनेस रिगार्डिंग द क्लिनिकल nutrition, being a medical expert or being a common man. So that is the concept of this webinar, right? तो जैसे मैंने बताया कि either we talk about the clinical nutrition and other name is a therapeutic diet. तो जब हम उसकी बात करते हैं तो we think as a modification of the diet. So now what is the purpose? Why we want to modify our diet to treat our disease, to treat our mind, our body and our soul, to provide the good nutrition to the body. क्योंकि हम जब भी डाइट लेते हैं, being a common man, being a health expert, we are unaware that which nutrient is important for our health. Even most of the people who are suffering from the depression, they are lacking in the nutritive balance in the diet, and that's why they continue with the symptoms of the depression. So even for the clinical psychiatry is another branch of the clinical nutrition where also we think about the diet and the nutritive balance in the body. By this therapeutic diet, the purpose to provide the therapeutic diet to our patients or to ourselves, the only purpose is to provide the good nutrition to the body, to balance or to rectify the deficiency. एक अच्छी चीज मैं बताना चाहूंगी यहाँ पे कि जब भी हम डाइट और न्यूट्रिशन की बात करते हैं, हमारे दिमाग में एक ही चीज होती है कि कुछ न्यूट्रिटिव फैक्टर्स जो है या कुछ न्यूट्रिएंट है उनकी कमी है, तो वो हमें रेक्टिफाई करना है. पर एक अवेयरनेस मैं आज देना चाहूंगी कि जब हम न्यूट्रिशन के बैलेंस की बात कर रहे हैं तो दोनों एक्सट्रीम में सोचेंगे कि आइदर कोई न्यूट्रिएंट की डेफिशिएंसी है or we need to fulfill that deficiency by the therapeutic diet, or the excess of any nutrient and we need to decrease. As for example, if the patient is suffering from the hypertension, we need to decrease the sodium level in the body, or by that the sodium level in the diet. So in some of the cases we need to decrease the nutritive amount. In some of the cases we need to just fulfill that nutritive deficiency in the body. So by either way, we need to balance that nutritive factors inside our body. So that is all about the therapeutic diet. Now, what are the types when we are talking about the clinical nutrition or the therapeutic diet? We need to learn the different types of the therapeutic diet. So first is the modification in the consistency. I mean, being a health expert, we all are aware that in the post-operative procedure, when the patient can't consume the regular diet from the next moment, and at that time, we are giving the liquid diet to that patient because our gastrointestinal system is not that much strong that it can digest the regular diet. So we need to change the quantity or the consistency of the diet for the therapeutic purpose. Either we give the liquid diet to the patient after the surgery, and then we gradually move to the soft diet, right? So it is easily digestible to the for the GI tract, and then we move to the patient for the regular diet. So in some of the cases, the consistency should be adjusted according to the patient's condition. In some of the cases, we need to change the frequency of the diet. If the person is suffering from the gastrointestinal disturbances, जब भी ऐसा होता है कि हमारी जो GI सिस्टम है या तो जो पाचन तंत्र है उसके अंदर इन्फ्लामेशन होता है, the cases we know all, the ulcerative colitis और the Crohn's disease. तो जब भी पाचन तंत्र में जो भी हमारे जो इंटेस्टाइन है उनके अंदर जब इन्फ्लामेशन होता है तब इंटेस्टाइन कैन नॉट वर्क प्रॉपरली. In that case, we need to change the frequency of the diet because patient cannot consume the regular quantity of the food at the same time. So we need to break down the food quantity being a small portion of the food at the regular interval. So it is all depend upon the clinical condition of the patient. We need to make the changes in the diet. Now the basic concept, because we all are aware that when we have to just change the diet modification, we only think about the physical diseases. Now let me talk about the nutritional psychiatry. This is also a very good sub-branch of the clinical nutrition where we can think about all the psychological disorders which can be treated by the diet modification. अब हमें ऐसा लगेगा कि जब हम डिप्रेशन में है या तो फिर हमारा स्ट्रेस लेवल कुछ ज्यादा है या तो फिर अल्जाइमर डिजीज है जहाँ पे हमारी मेमोरी लॉस है, तो ये सब डिजीज का डाइट से क्या लेना देना, क्योंकि जब फिजिकल कंडीशन की बात करते हैं तो हमें लगता है कि नहीं भाई चलो ठीक है डायबिटीज है तो डाइट मॉडिफिकेशन करना पड़ेगा या तो फिर हाइपरटेंशन है तो मॉडिफिकेशन करना पड़ेगा. पर व्हाई वी नीड टू चेंज अवर डाइट इन केस ऑफ डिप्रेशन और इन केस ऑफ अदर साइकोलॉजिकल डिसऑर्डर? So this is what it is called as a nutritive psychiatry, which is a wonderful and interesting sub-branch of the clinical nutrition. Now, let me tell you the fact why our GI tract और जिसको हम पाचन तंत्र बोलते हैं उसका कनेक्शन जो है वो ब्रेन के साथ कैसे है. सबसे पहले वो कनेक्शन जानना जरूरी है बिफोर वी प्रोसीड फर्दर. सो नाउ लेट मी बिकम वेरी प्रैक्टिकल एंड टेल यू कि अभी भी हम जंक फूड ज्यादा लेते हैं या तो फिर वेस्टर्न फूड ज्यादा प्रीफर करते हैं. जब हमारा ऐसा फेज होता है वी ऑलवेज फील डल, right? We do not motivate to go for our work every morning. We feel lazy, we feel demotivated, we feel little bit low with our emotions because we are regularly consuming a junk food. आई थिंक आयुर्वेदिक डाइट में भी बहुत सही तरीके से इन चीजों को एक्सप्लेन किया है कि जैसे उसमें 3 पार्ट्स का डाइट जो है अकॉर्डिंग टू द आयुर्वेदा, द सात्विक डाइट, राजसिक एंड तामसिक. उसमें जब तामसिक डाइट की बात करते हैं, तामसिक जो आहार है उसकी बात करते हैं, तो उसमें वेरी क्लियरली मेंशन कि व्हेन यू आर कंज्यूमिंग द जंक फूड यू फील वेरी लेजी, वेरी डीमोटिवेटेड. सो दैट मीन्स देयर इज अ सम कनेक्शन बिटवीन योर the food intake and your mental plane, your health. This is the one thing. Now second thing, being a medical practitioner, we are aware regarding the neurotransmitter. These are the cells which can manage our mental health, our emotional health, right? These are the brain cells. Now the structure of the neurotransmitter, which is made up of the amino acid, and we all are aware that amino acids are the protein, right? The 70% of the brain and the brain cells are made up of the fat, right? And the carbohydrate, which is also one of the major nutrients which required to brain for the better functions. So these 3 major nutrients, carbohydrate, fat, and protein, are so much required for the brain functions and the rebuilding of the brain cells. That means there is a connection between the diet and the brain, right? Because we all feel that we should not take the fat in our diet. It is very unhealthy for us, but we should not forget that each and every nutrient is helpful for our mental as well as the physical plane. Just we need to balance the amount of the nutrient we are taking while we are suffering from the any disease or while we want to prevent any complications. Let's talk about the micronutrient. I think being a medical practitioner, we are aware that the 6 nutrients which are very helpful for our body and our mind to function very properly. The major nutrient or the macronutrient are the carbohydrate, fat, and the protein. And we talk about the micronutrient, then we are talking about the vitamins, and there is a minerals, right? And water is also important for the proper functioning of the body and mind. So if we are suffering from the depression, that means at some point of time we are consuming a wrong diet. Either that diet is lacking in the vitamins, either that diet is lacking in the minerals, or either that diet is lacking in the macronutrients in your food. So being a practitioner, being a clinical nutritionist, we have to take the detailed case taking when the patient come to us. Either your patient is suffering from the physical disease or either your patient is suffering from the mental disorder. We need to take the detailed case taking and to understand first the dietary pattern of that patient. And then we can rectify that or we can modify that dietary pattern. Now, the simple question, when we understand each and everything about the clinical nutrition, then we think that how to do this case taking, because it is a very complicated part when we are talking about the case taking, because each and every pathy has the different mode of case taking. If we talk about the allopathy, they only focus on the pathological condition or the diagnosis of the patient, and according to that, they prescribe the medicine. If we talk about the Ayurveda, then they focus on the all the cough, teeth, and Vata, and the three dosh, because that is very important for them to know and to rectify that imbalance of the three dosha, and that is how they prescribe the medicine. If we talk about the homeopathy, we always believe that whatever disturbance in our body or either in our mind, it is only because of the vital force inside us, it got disturbed. So we need to place that vital force at the right place to heal the patient, to cure the patient from the root of the cause. But when we talk about the Ayurveda, then we focus on the dietary pattern, before the disease develop, after the disease develop, and the current condition. You can ask for the likings in the food to the patient. You can ask about the disliking. You can ask about the any food allergies if the patient have, because some of the patient are suffering from the allergy to the lactose. Some of the patient are suffering from the allergy to the gluten. So many of the food particles or the food ingredients, they are allergic to the some of the patient. They are hypersensitive to that, and they develop the certain complaint when they consume such type of food. See, we have to know regarding the allergy to the food. Also, we can ask for the dietary changes they feel, because as a medical practitioner, we are aware that if the patient can consume the certain food when he or she was healthy, but after developing the disease, he or she cannot take that food, and that food may cause the certain symptoms. If the patient is suffering from the ulcerative colitis or the inflammatory condition of the GI tract, then patient can't consume the proper quantity of the food at the same time. If the patient consume the spicy food or the food which can increase the inflammation, it can just lead to the diarrhea, nausea, and vomiting. So we need to know the dietary changes in the pattern of that particular individual. We also need to know the clinical condition of the patient while we are taking the case of that patient, because if the patient is suffering from the diabetes or any renal diseases or the hypertension and some of the cases of the cancer, we need to know the stage of the disease, and according to that we can prescribe the diet therapy. I think most of the diseases in nowadays which can directly affect the immunity of the patient. हम सबको पता है कि हमारी जो रोग प्रतिकारक शक्ति है, that is very important to keep us healthy in both the ways, on the physical plane as well as on the mental plane. But when that immunity decrease, the multiple causative factors attack us and make us sick. So that's why the immunity enhancing diet is very important in most of the cases. Now let me give you the another connection between the gut or I mean Pachan Tantra and the brain. As we all know that, and I think in homeopathy and Ayurveda it is very clearly mentioned that our intestine or our Pachan Tantra has the healthy bacteria or viruses or fungus inside that, and that healthy biomes help us to break down the complex carbohydrate to reproduce the vitamin, minerals, and the short chain of fatty acids. Uh, so when we consume the wrong food, I think ये जो चीज है वो मैं हिंदी में भी बताना चाहूंगी कि हमारे पाचन तंत्र में healthy bacteria होते हैं and those bacteria will help us to digest the food. पर जब भी हम wrong diet consume करते हैं, then it produce the alteration in that bacteria formation, and that's why it can directly affect your mental health, which can gives you the low emotional level, or you feel stressed, or you cannot cope up with your daily stress and the anxiety. So somehow our GI tract is directly connected with the brain and the vagus. Now we all know that, which can supply both to the GIT as well as to the brain. So this is the scientific connection between the GI tract as well as the brain. And that is how we can convey our patient that whatever the food you consume, it can directly affect your emotional level and your intellectual level. So this is all about the clinical nutrition, the basic information, as well as the nutritive psychiatry, which is the sub branch of the clinical nutrition. Now, at last, I want to just give example of one disease, and that is how we understand the clinical nutrition in a practical way. Let's take a very common disease from which the most of the people are suffering nowadays. It is the disturbance in the GI tract, which we called as a diagnosis IBD, the intra-bowel disease. That means the inflammation of our intestine. As we all know that we have two intestines, the small and the larger one. When there is an inflammation of the small intestine, it is called as a Crohn disease. And when there is an inflammation of the large intestine, it is called as ulcerative colitis. Most of the people nowadays, when you talk with them, they always complain regarding the suffering from the GI disturbances. Either they consume the food and they need to go for the vomiting or the nausea, the acidity, the hyperacidity, or they need to go for the diarrhea. And this disease is called as an idiopathic disease, right? We all know that the idiopathic disease means not the specific pathological condition or the causative factors responsible for such type of disease, but internal stress is the strong factor. Your wrong dietary intake is another strong factors which are responsible for the inflammation of your GI tract. So in that way, when your GI tract is inflamed, when there is a disturbance in the composition of the healthy bacteria which are present in your intestine, it can directly affect your physical plane as well as your mental plane. So we need to act on the specific area by modification in the diet. So if the person or if our patient is suffering from this ulcerative colitis or Crohn disease, I think in the Western countries, you will find such type of cases very common, because Western diet can definitely harm your GI tract, because most of the diet is very inflammatory in nature, and that's why it can lead to the inflammation of your bowels, and that is how it is disturb your physical and the mental plane. So now, let me give you the clinical nutrition or the therapeutic diet. Let me just suggest you for the ulcerative colitis. So in such cases, if the patient come to us, of course, we should go for the detailed case taking of the dietary changes as well as the clinical condition. We also look for the reports the patient went for, and then we can suggest. Actually, I am talking about just a general therapeutic diet for the IBD patients. When patient come to you, you can go for the individual case taking, and you can just suggest a diet according to his or her sensitivity and the diet modification and the clinical status. So if the patient is suffering from the ulcerative colitis or the Crohn disease, you should go for the low fat diet. Whenever you suggest the fat in the diet of your patient, you should go for because there are the two type of fat, the soluble fat and the insoluble fat. So insoluble fatty acids are preferable for the patient, and soluble fatty acids or the saturated fatty acids are always harmful to the patient. So low fat diet is very important. If the patient is allergic to the lactose and gluten, so you can restrict such type of diet, the dairy products and the gluten-free diet for that particular patient. If the patient is suffering from the ulcerative colitis, you need to reduce the salt and the sugar level in the patient. This is how you can just modify the diet according to the clinical condition as well as the individual symptoms from which the patient is suffering. So these are the basic information regarding the clinical nutrition. And I think I summarize once again this topic, that this clinical nutrition or therapeutic diet is not just a regular diet. We need to modify our diet, either the content of the nutrients we are consuming, either the quantity of the diet or the quality of the diet or the frequency of the diet. So this is how the modification is required to heal the patient from the inner side. And that is how I think I have conveyed the basic information of the clinical nutrition to all of you. So thank you so much. I mean, any question from your side or anything you want to ask me, I'm here to give the brief or the understanding from my side.
Thank you, Dr. Vachini. First of all, you differentiate with the normal nutrition and between the clinical nutrition. But
Yeah.
my personal question is this: that we have very less persons of suffering from these different idiopathic diseases or other diseases. So the question comes that uh, let me ask simple, very simple questions. Uh, let there is common cold to me or to my kid. What kind of diet should be given to a patient or a child, or what kind of diet should not be given?
Okay. So, common cold or any viral infection, which is very common in the pediatric cases, because pediatric age group is very much sensitive to the viral infection, and that immunity is comparatively low compared to the adult, right? So that's why the pediatric cases of viral infection we can commonly found. Now, by two ways we can just modify their diet. Number one is we need to ask about the individual characteristic, because if the child is suffering from the viral infection, we need to know either it is a seasonal viral infection, or when the season is changing, the child gets the infection, or by if the child consume, as soon as he or she consume any cold food or any cold drinks, and he or she started the viral infection, I mean common cold, and with that high grade fever. So first we need to understand the causative factor, or sometimes the pediatric cases who are suffering from the common cold, there must be a genetic factors is also responsible for that, this frequency of occurring of the common cold. So individual case taking is also required. Now, secondly, when we are talking about the common cold and the fever, we need to understand that the food which can have the cold, or which can just increase the coldness inside the body or having the cold tendency, as for example ice cream or cold drinks or even a curd, which है आपने मतलब हम ऐसा बोल सकते हैं कि जिसकी तासीर जो है, जो ठंड पैदा करती है बॉडी के अंदर, that type of food should be restricted. We can suggest the warm food, we can suggest the home cooked food, or we can suggest the food with the little bit spices, because if we are using the spices which we used to use in our daily kitchen recipes, that spices will give you the warmth inside the body, and that is how we can decrease the tendency of this common cold simultaneously with the medicine. So we need to restrict the diet which can increase the common cold, and which can, or also we can involve the garlic or the spices or the food which can increase the heat inside the body, and so we can go that. Also we can think of the this ayurvedic जिसको हम बोलते हैं कि आयुर्वेदिक उकाड़ा जो होता है, जो मतलब घरगथ्थु चीजों में से we can prepare. Also we can give such type of drinks to our kids as well as to the adults. So that is how we can correctify the diet for the particular common cold and the viral infection.
थैंक यू डॉक्टर वाचनी। एक बहुत अच्छा क्वेश्चन आया है, ये पूछ रहे हैं कि डाइट के अंदर क्या ऐड किया जाए या कौन से ऐसी चीजें खाई जाए जिससे डिप्रेशन कम हो और हमारे ब्रेन के अंदर डोपामिन लेवल इंक्रीज हो।
Yeah. So depression is actually a wider term, right? Depression हम कभी भी थोड़ा सा लो महसूस करते हैं या फिर we feel anxious, so we consider it as a depression. So the general term is when we feel low on the emotional level, when the stress and anxiety increase inside us, and that is how we feel the depressed, we feel lonely, we do not like to talk with or mingle with other people, and that is how we feel low on the intellectual as well as on the emotional level. And that is how we consider is a depression as a common term. So when you find yourself as in a depressive mode, you need to check on your diet that either I am lacking in certain nutrients in my diet, and which can lead to the depression. As for example, if you are suffering from the depression, you should go for the vitamin check, because your diet should be included vitamin B12, vitamin B1, vitamin A, C, E, and such type of vitamins are helpful in the depressive cases. Let's talk about the vitamin B complex. In vitamin B complex, vitamin B12, B1, B6, and folate. So this deficiency should be rectified when you are suffering from the depression. Let's talk about the vitamin A, C, and E. Why these vitamins are required when you are suffering from the depression? Because these vitamins are full of the antioxidant property. As we all know that we need to include the antioxidants in the diet, which can help to reduce the depression or the stress level inside our body. And lastly, the vitamin D, what we usually get from the sun exposure, and that is also very beneficial in the case of the depression. So this is the case of the vitamins. Now let's talk about the minerals. When you are suffering from the depression, you should always go for check the mineral called the zinc, then lithium, then selenium, and then iron in your diet, because lacking of this nutrient or these minerals in your diet, which can increase the depressive symptoms. So you can go for the dry fruits or the nuts or the protein filled diet to just compensate this vitamin and mineral nutrition deficiency in your diet, and that is how you can just get out from the symptoms of the depression.
So with this, one pertinent question comes: should we take the supplements when the deficiency of some vitamins or minerals is there, or we should be dependent wholly solely on the food?
Okay, when you consult your nutritionist, I mean, he or she suggests some modification in your diet, but if they suggest you to go for the extra supplement, you should go for that, because many of the patients are scared to take the supplement because they believe that it can give the addiction or they become addictive to the supplement, but that is not the right thing. You should go for the supplementary vitamin and mineral deficiency for the certain period of time. Once your body is compensated with the deficiency, you can just stop that supplement and you can just shift to the regular diet. So of course you can go for the supplement, but it is if it is under the guidance of the clinical nutritionist or your health expert.
थैंक यू डॉक्टर वाजनी। फ्रेंड्स को मैं सभी दोस्तों को ये बताना चाहता हूँ, क्योंकि हमारे चैनल का नाम स्पिरिचुअल डॉक्टर होलिस्टिक हेल्थ है, तो होलिस्टिक हेल्थ के लिए डिप्रेशन की बात चल रही है, तो विटामिन एफ बहुत जरूरी है फ्रेंड्स।
Pardon?
विटामिन एफ
Vitamin. So
जिन
you
लोगों के पास
just
दोस्त नहीं होते हैं तो तो उन लोगों को
have.
डिप्रेशन आना, आप कोई भी सप्लीमेंट ले लें, कुछ भी ले लें, कैसी भी डाइट ले लें, तो लोग विटामिन एम के पीछे भागते हैं बहुत सारे लोग, तो उनको भी डिप्रेशन हो जाता है, विटामिन एम मनी और समथिंग। तो
Yeah.
ये दोस्तों को सबको जरूरी है, विटामिन एफ लेते रहिए। तो ये भी एक अच्छा विटामिन है जो आपको सप्लीमेंट करता है, कहीं बाजार से नहीं मिलता है। ये जैसे डॉक्टर रंजन, मैं दोस्त है बहुत अच्छे, डॉक्टर वाशनी भी हमारे बहुत अच्छे दोस्त हैं। तो इस तरह दोस्तों से मिलते रहा करो दोस्तों, डिप्रेशन का ये बहुत अच्छा एंटीडोट है, बहुत अच्छा सप्लीमेंट है। अ, तो this is not a joke, this is just a fact we want to share with everyone. And डॉक्टर वाशनी, नेक्स्ट क्वेश्चन पे आते हैं हम लोग। आप इसके बारे में क्या कहना चाहेंगे डॉक्टर वाशनी, डॉक्टर रंजन?
मतलब किसके बारे में? डिप्रेशन के बारे में?
डिप्रेशन,
डिप्रेशन.
डायबिटीज के बारे में।
दोस्तों से, लोगों से मिलते रहने के बारे में।
Ah, that's the lovely thing, and because I actually believe that, and since last 15 years, I am connected with the youth very nicely, and in this next generation, what I feel that they are so much socialized on all the social platforms, but they are not sharing their things to their friends or to their parents, and that is why their internal suffering is increasing day by day. So I think we all should need to know that sharing is one of the best treatment when you feel alone, when you feel depressed. I mean, by giving you the very practical example, when you go to the doctor, right? We are not talking about the homeopathy, but when you are go to the doctor, your doctor listen to your symptoms very carefully, right? And that's why even before he prescribe medicine, you feel good that my doctor listened to me from the complaint I am suffering. So listening, by even listening to someone properly, you can just heal that person 50% of cases. So I mean, in today's era, the sharing is very important. And just my advice to the next generation, that please share. Don't feel alone and don't suffer alone, because this suffering in loneliness can lead to the extreme of condition. Either you feel depressed and lead to the suicidal tendency, either you feel aggressive and you become destructive. So better way is to share your emotions, whomever you can trust, either your teacher or your parents or your friends or your guide. By sharing the emotions in a right way, makes you feel so good, makes you feel relaxed, and makes you feel that there is a source of light in your life which can still have a hope to live a better life. So that is very important. And I agree with the point that friendship, socialization in a real way is very important, not only for the social media.
नेक्स्ट क्वेश्चन डॉक्टर वाचनी ये है, someone is Veena is suffering from minor thalassemia. Can you suggest some diet for the minor thalassemia?
Okay. In minor thalassemia cases, as we all know that it is the disorder which is relating with the circulatory system or the bleeding disorder. In such cases, you should go for the iron-rich diet therapy. So we can go for the vegetables or the fruits or the dry fruits or the nuts which are full of iron. So iron which is needed to your body. Also, in such type of disorder or the diseases, you should just work on your immunity. And the immunity can be increased by the protein-rich diet. You should increase the protein intake in your supplementary diet. Supplementary, if you are vegetarian, you can definitely go for the milk and the milk products or the legumes or the different types of beans. And all this will give you rich in the protein. Or if you are non-vegetarian, you can also go for the diet which is full of protein. So protein intake and the iron-rich diets are very helpful when you are suffering from the minor thalassemia. And we should know that if even if we are not suffering from the any disorder or the any pathology, we should be always aware regarding the balanced diet. We should not consume any particular nutrient in the excess, because we always think about the deficiency in the nutrition, and that is how we prescribe the therapeutic diet. But let's talk about the obesity or the weight gain. In such type of cases, we need to decrease the fat amount, we need to decrease the sugar and the salt in our diet, and that is how we can help the patient who are suffering from the obesity. So that is how we need to balance. Yes, someone has, I think, mentioned the vegan diet. Yeah. So vegan diet is also helpful. I mean, it is a preferable. It is upon you. If you want to go to the vegan diet, you can definitely go for that. It requires the determination of the mind, because since so long, if you are consuming the diet which is include the animal products, so by the strong determination, you can surely shift to the vegan diet. And yes, the vegan diet also has many options. By that, you can compensate the nutritive balance inside your body. So vegan diet, as we all know, that it is a completely plant-based diet where we do not consume any dairy products or any animal products, and just we consume to the all the plant-based substitute of the nutrients. So you can definitely go for the vegan.
Next
And
question
there
जो
is a strong community, I mean, who always recommended the vegan diet, but it is all up to you.
जो नेक्स्ट क्वेश्चन है मेरी बैचमेट है डॉक्टर कमाक्षी गर्ग फ्रॉम पटियाला, तो उनका ये क्वेश्चन है, वो पूछ रहे हैं इंटरमिटेंट फास्टिंग, कीटो डाइट और सो कॉल्ड फैब डाइट्स, उनके बारे में आपका क्या टेक है?
Yeah. Let's first talk about the intermittent fasting. Actually, intermittent fasting is suggested that between your two major meals, you should go for the 10 hours and then increasing 12 hours and 16 hours fasting phase between the two major meals. So, for my clinical, in my clinical practice, I have seen that some of the patients find difficulty to following the intermittent fasting, while some of the patient can easily shift to the intermittent fasting. If we go with the scientific base, yes, intermittent fasting is always beneficial for your health. If you want to reduce your weight, or if you want to increase your immunity or the health status, yes, intermittent fasting is very beneficial. But if you cannot change to such fasting level, you can just go for that. And if you can't still, I mean, follow that intermittent fasting, it is okay. We can go for the some other ways to maintain your health, to decrease your weight, and to increase your immunity. But according to the Ayurveda, according to the healthcare expert, the intermittent fasting is very helpful to your digestive system. So you can definitely go for that. And I think the second word I forget, which is that?
कीटो डाइट.
Keto diet, yes. Keto diet, I have seen that some of the young girls, before few years, when they were following the keto diet just to reduce the weight, and then they lead to the complication. So it is my humble request that if you want to follow some specific diet, you should go under the instruction or the observation or the guidance of the nutritionist or the health expert. Otherwise, this specific diet may lead to the complication. The keto diet is mainly prescribed definitely on the physical complaint, as well as the person is suffering from the epilepsy. In such cases, the keto diet is preferable, where you need to just decrease the carbohydrate level and increase the healthy fat level. Because when you decrease the carbohydrate intake in your food, your mind, your body start to just break down the protein and the fat to get the fuel or the energy. That is how your body and mind works. So it is a specific diet which you should follow under the proper guidance of the nutritionist. If you are healthy, or if you are not suffering from the any major physiological or psychological complaint, that is my suggestion. You should not go for the any specific diet. Just little bit correction in the or the modification is on the diet is always helpful.
Next, someone is asking how they can connect with you. And when we shared your that the next coming up clinical nutrition program, so can you tell us briefly, very briefly, about the what kind of program this is, who can attend this, and what kind of benefit they can get out of that? Just briefly.
Definitely. So clinical nutrition is basically, as I have mentioned, that it is a modification in the diet which can be helpful to provide the good nutrition to your body, which can be helpful to increase your immunity as well as to heal from any physiological or the psychological disorder. It is a whole branch which include the modification of the diet, or you call it as a therapeutic diet. It also deal with the nutritive psychiatry, what I have also mentioned. Then it also include the food safety, the nutrition, infection, any type of diseases we can definitely help with the diet modification. It also include the diet and nutrition of the mother, pregnant lady, lactating woman, or the newborn child, the pediatric cases, as well as the geriatric cases. So it affect the all paramedical branches. It affect the all range of the disease, from the simple disorder in your body, or if simple you feel that emotionally low, to the cancer, or the you can see the idiopathic diseases. So that is how the clinical nutrition branch is established, and I'm working on that. If you want to connect me for this, you can just take my contact number from both the doctors. They are.
If you can share some email ID where someone has some query, they can directly
So
approach.
I can share my email ID and contact number to both of you when you
Right
just
now,
said.
we can also share because it's a live program.
So it is drvhbhatt@gmail.com.
Uh, can you repeat it again,
So
Dr.
many books are available for the clinical nutrition, but you should, if you want to learn regarding the clinical nutrition, I always prefer that you should go for such type of webinars, or I think videos of the clinical nutritionists, and that is how you can just enhance your knowledge, and you can also practice in such a field if you have if you have done on any certificate course or any classes of clinical nutrition. And it also include the Ayurvedic diet. I forget, because clinical nutrition also includes the Ayurvedic diet, and that is the basic diet for all our Indians. So we also need to know the how the Ayurvedic diet, or the I mean, in Ayurveda it is said that rasodu age aushadhalaya. That means the whatever ingredients are present in your kitchen and you are using to cook your food, that can be also the medicine to heal your body, to heal your mind. So we can also include the Ayurvedic diet in the clinical nutrition.
Dr. Vachini, can you repeat the email ID again, please?
Yeah,
Doctor?
yeah. Dr. Doctor DRVH Bhatt, DRVH Bhatt @gmail.com.
So, friends, if you have any query, you want to know about the clinical nutrition program, which is going to be run by Dr. Vachini, you can directly email
Oh,
on.
no, no, no. And that is a mistake. DRVH, not VAH, VH. DRVH Bhatt.
डॉक्टर वाचनी, ये तो हो गया हमारा क्लिनिकल न्यूट्रिशन की साइड में अपना जो पूरा टॉपिक आ गया। अभी हम चाहते हैं जो हेल्दी लोग हैं मेरे जैसे, डॉक्टर रंजन जैसे, जो हम 100 साल जीना चाहते हैं, हम लोग
Yeah,
हम चाहते
definitely.
हैं हम सेंचुरी मारें, और उन लोगों के लिए, बाकी सभी लोग जो एक हेल्दी और हैप्पी लाइफ जीना चाहते हैं, उनके लिए ऐसी कौन सी 5 टिप्स आप देना चाहते हैं, ताकि नॉट थिंकिंग मच, क्योंकि वट एवर इन योर हैबिट दैट विल कंटिन्यू। क्योंकि कुछ चीजें ऐसी होती है बहुत 2 महीने की, 3 महीने इंटरमिटेंट फास्टिंग हमने कुछ समय की, कुछ समय नहीं की, तो ऐसी कौन सी 5 हैबिट्स है, डाइटरी हैबिट्स हैं, अगर हम फॉलो करें तो हम सेंचुरी और हम हैप्पी और हेल्दी लाइफ जी सकते
So here I can just share whatever I do in my daily life.
हैं।
If it can be helpful
We
to
want to learn that
anyway.
only because you are very fit and yes.
So I can just share whatever I do. Actually, the first thing is, जो भी मुझे अच्छा लगता है, जो भी करना, that I include in my daily routine. As for example, if I love to do exercise, I included in my daily routine. If I love to do some work, I included in my daily routine. Because अगर हमारा daily routine उन चीजों से भरा नहीं होगा जो चीजें हमें अच्छी लगती है, then you don't feel motivated to go for a work next morning. तो जो भी चीजें हमें अच्छी लगती है, we need to include in our daily routine. Secondly, Secondly, the second tip, which is very helpful to me since last 15 years, that we need to spend time with ourselves. मतलब हम सबके साथ time spend करते हैं हमारी families के लिए, friends के लिए, और 90% our time is consuming by our work or our profession. So second tip is I always try to make 40 minutes, at least 40 minutes in a day, where I can be with myself. No one else, not my husband, not my parents, not my even son. So I love to be with myself, and that is the time I just use to think about obstacles or my life problems or what are the motivating factors. So second tip is to just spend the time with yourself. Number 3, if you want to feel fit physically, you should go for the exercise. You should go for the correct balanced diet. I'm not talking about that you should go check on each and every diet, but as much as you can try to go for the healthy diet. I mean, once in a while, if you go for outside food or junk food, that is fine. But most of the time, you need to focus on your diet because it is very important to keep you healthy on a physical and the mental plane. Now 3 हो गया ना, अभी 4th one. Okay, 4th one is I always pursue my hobby, because sometimes क्या होता है ना, जब हम छोटे होते हैं हमारी बहुत सारी हॉबीज होती है कि जैसे ड्राइंग करना या फिर सिंगिंग करना या फिर डांसिंग करना, फिर जैसे हम बड़े होते हैं वी नीड टू फॉरगेट बिकॉज हमें बहुत सारा काम होता है. तो वी ऑलवेज शुड फोकस कि जब भी हमें टाइम मिले वी शुड जस्ट गो फॉर आवर हॉबी, बिकॉज दैट इज द थिंग ऑफ इंस्पिरेशन, दैट इज द थिंग ऑफ मोटिवेशन, एंड दैट कैन मेक्स यू अलाइव. एंड नंबर 5, मेरा हमेशा ये मानना है कि आप अंदर से खुश रहिए. अगर आप अंदर से खुश है, then and then people love to connect with you, then and then you can advise the other people to be happy, then and then you can spread the happiness to others. और अभी आज के एरा में हम अगर किसी को कुछ दे सकते हैं, that is the only one thing we can just give the happiness, we can just give the platform to other people so they can come and share their problem with us, and that is the best service I think in this today's era we can offer to the society. So जो भी हमें दूसरों के पास से चाहिए वो हमें सबसे पहले अपने अंदर लाना पड़ेगा, and then we can advise to other people. So I think these 5 things I follow since 15 years, which help me to feel motivated each and every second, even though so many stress and obstacles as we all have in our daily life. So that is the thing I can share.
यस, जिंदगी में ऑब्स्टेकल्स आते हैं, वो प्रॉब्लम्स आती हैं, लेकिन हम लोगों को वही चीज दे सकते हैं जो हमारे पास होती है. तो फ्रेंड्स, जो आपके पास है, खुशी है तो खुशी बांटोगे, दुख है तो दुख बांटोगे, आप हेल्दी हो तो हेल्थ बांटोगे, अगर आप बीमार हो तो बीमारी आप बांटोगे. सो गिविंग इज द मोस्ट इम्पॉर्टेंट थिंग. स्पिरिचुअल डॉक्टर का जो पर्पस है वो भी यही पर्पस है. हम ज्यादा से ज्यादा जो ये प्लेनेट है उसको कैसे हैप्पी और हेल्दी बना सकते हैं, कैसे हम होलिस्टिक हेल्थ को प्रमोट कर सकते हैं, कैसे लोगों को ज्यादा हैप्पी कर सकते हैं, इसी पर्पस के साथ हम हर वीक आपसे मिलते हैं. डॉक्टर रंजन, ओवर टू यू.
या तो डॉक्टर वाशनी ने अभी जो कहा, स्पेंड टाइम विद योरसेल्फ, स्पिरिचुअल डॉक्टर्स हाईली रिकमेंड दिस प्रैक्टिस, और इसका एक दूसरा नाम मेडिटेशन भी है. वैसे मेडिटेशन के अलावा भी आप अपने साथ जो टाइम बिताते हैं, खुली आंखों से भी बिता सकते हैं अपने साथ टाइम, लेकिन बंद आंखों के साथ अपने साथ आप जो समय बिताते हैं उसे मेडिटेशन कहा जाता है. तो स्पिरिचुअल डॉक्टर्स फॉर होलिस्टिक हेल्थ पे आफ्टर द टॉक सेशन we go for 10 to 15 minutes of meditation. So my dear friends, thank you Dr. Vachini, thank you very much.
Thank you very much Dr. Vachini. आज का सेशन
knowledge.
Thank you.
नेक्स्ट टाइम इसी जो हमने जो शुरू की है, एक बिल्डिंग बनाई है, इसको हम और आगे अपनी बातचीत को और आगे लेके जाएंगे. आपका बहुत बहुत धन्यवाद.
Thank you so much. Thank you so much for inviting. Thanks a lot. Should I leave the meeting now?
If you have time to join with us, sit with us for 15 minutes, you are welcome to stay with us. Or if
yeah, please pardon me this time because I need to go home. It's a Sunday.
Yeah, it's
and I'm
okay.
sure we all will meet you again. And once again, at last, I'm very much thankful to Dr. Sandeep Jyot and Dr. S. Ranjan for inviting me and to make me a part of this beautiful community which works on the holistic health. Thank you so much.
Thank you.
Thank you.
Thank you.